This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone, and welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. And I'm sure most of y'all that listen to me know what I do. I am kind of foundationally, I'm a direct primary care doctor. I've done episodes about that in the past. It's been a while. And, I have got away from the quote, conventional insurance-based model of medicine, as I feel like this is better healthcare. And today I'm going to interview someone who's doing a similar model of direct care, but she's a specialist. She's a rheumatologist. And so when I learned about her, I really wanted to get her on the show just to kind of pick her brain about her practice and why she's doing this, because I just really feel like it, we need to be more aware of this, and that more specialists do this. And that's kind of my hope, is that we'll see more and more specialists in the future do this style of practice that, again, I feel is just better healthcare. So my guest is Dr. Serene Mumtaz, MD. Her home base is in Florida, although she does some virtual care in multiple states. And she has founded Remission Rheumatology, which is her direct care model of rheumatology. And that's what we're going to talk about today. So, Dr. Mumtaz, appreciate you coming on, and welcome to the show.
Thank you so much for having me. I'm grateful to be here and excited about this opportunity to learn more about direct specialty care model and talk more about that. And yeah, I'm very grateful for your interest in that as well.
Yeah, well, let's, I guess, start with, what made you as a specialist, number one, I guess, discover this kind of model of care, because a lot of people or a lot of physicians still don't even really know it exists. But certainly in the specialty realm, I feel like that it's just not even an option for a lot of people. Certainly, I'm sure most of your peers went the conventional route. So I guess talk about at what point did you discover this, and when did you make the decision to do this style of practice, and why?
Yeah, definitely. So, during training and also during my time as a hospitalist, I saw how fragmented and rushed the traditional care can be, particularly in specialties like where you don't have access to a whole lot of providers in one area. So, it became clear that the system wasn't serving the patients or the physicians. There are long wait times to see a rheumatologist, anywhere from minimum is, I think, 3 months. And in the area where I'm in, Jacksonville, it's running about 6 months.
Mm.
So it was more about a realization that there were patients falling through the cracks. They weren't able to get the attention or continuity that they deserved. And then during training, you would see them in like a large referral centers and tertiary care hospitals, where you would see the impact that it has on their health, just the fragmented care that they were receiving. So that definitely instilled a motivation in me. A turning point, I think, came when I saw that there were a lot of direct primary care providers, including some friends and some acquaintances that were doing this model, and it has gained such a movement in the US. However, the specialty care is still yet to catch up to that, but it can definitely be done. And that's when I decided that rheumatology could really benefit from this model.
Hmm. For sure. Talk about, making that decision, because especially, you're fairly new out of training, you said, and I'm sure you could have signed on to a big hospital making really good money. And I certainly believe with somebody who does this style of practice that in the long run, you're going to be way better for it and be happy you did this. But there certainly are sacrifices at the start, in that you're not going to be, receiving those big paychecks and getting all that. You're kind of starting from the ground up. So talk about, I guess, that decision, if you will, of how all that came into play.
Mhm. I think a lot of it also had to do with basically you are in control of what you want to do and what you can do
Mm-hmm.
with the services that you provide. So I think that was a big factor that went into this decision, not only being able to control your schedule, but really also it is more fulfilling when you're able to give patients the time that they need or the time that they require, especially in like complex systemic conditions like autoimmune diseases. So it definitely felt more fulfilling. And then again, another aspect is autonomy that you're autonomous. I mean, you're your own per se, you're your own boss, and you make your own schedule, your own rules, and so it doesn't only serve that aspect, but also you can practice the way you want it to be, the way you think it should be, like focused on patients and not really paperwork, not having that insurance barriers that limit the care that you provide. So I wanted to flip it and offer like proactive, personalized care and also accessible care by branching out to other states. I felt that um, patients in some underserved areas could really benefit from this. So these were all the thoughts that were going on in my head as I was deciding like what should I do after training.
What did your colleagues say as you were, had made the decision to do this?
Yeah, I have gotten the opportunity to interact with a few different providers in the area. And I received a lot of encouragement. I received a lot of great advice from them. There were actually two different direct specialty care providers in another field, neurology and cardiology, based in Jacksonville, who talked about how great the model had been for them. So that just gave me the push, the nudge, and the assurance that this can definitely work out.
I'm trying to think of, because I'm sure there's different obstacles from a specialty standpoint as from a primary care standpoint. But what are some of those obstacles as far as like from the patient standpoint? I mean, because I'm sure they're always surprised, like, what do you mean you don't take insurance? And especially on again on the specialty side, how are you going to be able to kind of keep those costs lower for them?
Mhm. So there are, because this model has been so popular with the direct primary care, in the direct primary care aspect, there have been resources including like negotiated cash pay services, diagnostic services, including labs and imaging that you can offer the patient. So again, that hurdle has been minimized because they have significant discounts for self-pay patients, for imaging, and for labs.
Mm-hmm.
Then the membership model, if you think of it, all is common in primary care, although in specialty care it's a new territory. But when you really try to explain it to the patients, for chronic disease management, like for example in rheumatology, they have tremendous benefits from this model and with good impacts of their on their health. So I think that's another aspect. I think the biggest hurdle is awareness. Again, like having patients become aware that this does exist. They do have this option. They can still use their insurance for diagnostic testing and medications. And if they don't wish to, there is, like we talked about, those negotiated um, labs and imaging and other resources available. So it's more about awareness. And then, of course, being like in the healthcare field, getting to be more comfortable about like the business aspect of things is another hurdle, I feel.
Mhm. Yeah, I was just having this conversation with somebody the other day about that things in healthcare um, really aren't that expensive, but they're expensive because the insurance companies have got involved and there's so many middle people. And that's really what direct care is that we take out all the middle people. And it's just a relationship between the patient and their doctor. And then the doctor can work on their behalf and work out really good deals. Like I was telling someone, I can get an MRI for $300 cash price, and many a times that's cheaper than even their deductible when they have regular full insurance. And also, you mentioned labs, and I get discounted price on labs. I mean, at 80% discount. And so when they're paying cash for those labs, and I get, I mean, I'm sure I don't get the specialty labs that you do, but I get more than most primary care doctors, and it's very, very reasonable. I just I feel like it's a great model of care. Did you say, there's a couple of other specialists in your area that you mentioned or that you reached out to? Are there other rheumatologists that you know of that are doing this?
There are rheumatologists, I think, yeah, nationwide, there are a few.
Not
Some
very
are
many.
offering pure telemed services at this point. I'm pure telemedicine as well. But yeah, in Jacksonville area where I am right now, there's no like pure direct care rheumatologist. So I think it's a handful
Hmm.
in the nation. Yeah.
Yeah. Okay.
Mhm.
So now, again, I know you're just getting started, but since you're doing this, like, how do you foresee your practice being different than your colleagues in traditional rheumatology? Like, how you said obviously you can spend more time with the patients and that kind of thing, but if we're specifically talking about a rheumatologic patient, like, how do you how do you foresee that being different
Mhm.
with this model of care?
Mhm. So, like the traditional practices that we talk about, they are running on volume. They're running on like RVUs, revenue, how many patients they're seeing, like mostly in and out door situation. So, and the doctors, they may be seeing like 20 to 25 patients a day. And then there's the
Mhm.
element of burnout. There's also the element of like follow up. Like, are you able to offer consistent follow up for your patients? Are you able to respond them in a manner that does not impact their health, and they have long wait times. So this model is intentionally smaller. We limit our patient panel. So like we have kind of a few, like we have some slots, like some patient slots, but once we fill, we will probably cap at that so that our care is more personal, it's more direct. They will have access to communication, instant communication in the form of like through a HIPAA compliant patient portal, through email, through a telephone line. We don't bill insurance, so there's no prior authorizations, but for our visit, but we definitely help them for that if they need like, of course, they need like biologics, advanced therapies. So we essentially don't go based on like billing code or what will benefit our practice. It's more about what the patient needs. And that's the main focus of our practice. So it's definitely different in those aspects.
What type of patient do you typically see as far as, specific demographics? And I know you're just getting started, but I mean, are a lot of people, for me as a primary care doctor, it's actually a good portion of mine have regular health insurance, but they just get tired of, calling the office and saying, well, the doctor can see you in 3 weeks from now or whatever. And so they like the access, they like the more kind of wellness mindset that I have. And so they just pay, the extra, for me. I do have some that are, just don't have insurance or they have a catastrophic type plan. What do you feel like it's going to be with you as a specialist?
Yeah, sorry. So I think the patient population we're targeting, it is above 18 years of age.
Mhm.
And at this point, we can see anybody. Like if you have insurance or you don't have insurance, that is not going to limit your access to us. However, of course, we cannot bill the insurance at this point. We're
Mhm.
not officially opted out of Medicare as yet.
Mhm.
So we are in the process of doing that. So until that is completed, we cannot take on any Medicare patients just by the legal aspect of things. So that is one limitation. So no Medicare at this point. But other than that, we are open to basically seeing anybody with any insurance. And again, they have that option to use whichever insurance they have for testing and medications. Otherwise, there are options for them. And that's what a lot of people are not aware of that there are options for self-pay.
Hmm. How do we get more specialists doing this style of practice? As a primary care doctor, it's very frustrating to me when I try to get people into a specialist, whether it's rheumatology, neurology, whatever, and it's 4 to 6 months. And then like you said, they're seeing, 20, 30 patients a day, and then these people wait months and months to get in to see the doctor, and then the doctor spends 5 or 10 minutes with them. So I love this model of care for both primary care and specialists, but how do we how do we get more specialists into this model?
Mhm. I think, yeah, the current system isn't very sustainable for specialists because patients, they want better access, doctors want to be doing more meaningful work, and the rates of people leaving the healthcare employed jobs is on the rise. Specialty care is definitely ready for innovation. Although we're seeing early adopters who are moving in this direction, we still need to keep on building awareness, kind of like what you are doing. And there are a lot of advocacy groups like DPC Alliance, the DSC, Direct Specialty Care groups who are creating a lot of awareness and kind of providing workshops and resources for specialists to look into this area, especially like when you have chronic conditions. You can utilize telemedicine, which was a big move after the COVID pandemic. So it's definitely becoming more central. It hasn't gone away. Again, patients themselves are wanting like more flexible, more accessible care that is more responsive. So they also like the integration of lifestyle medicine and technology. So I think the direct care models like ours will be becoming more common in the future.
I'm going to switch gears just for a minute and pick your brain a little bit about just rheumatology in general. I was thinking back. I don't know that I've had a lot of different physicians on my show, but I don't know that I've actually had a rheumatologist. But one of the reasons that I left kind of corporate medicine is I went on a deep dive and really learned a lot, I guess, on my own. And some of the things that I realized is how much we could do, I guess, without medication. And for instance, I learned that I can completely reverse type 2 diabetes. Nobody ever taught me that, because it was just a matter of throwing pills at them. And when the blood sugar is controlled, you throw more pills and you throw more pills and eventually put them on insulin. And nobody ever said, you can actually reverse it in most people. Autoimmune disease is another one that of how much you can do with diet and lifestyle and decreasing inflammatory foods and things like that. And so as I was learning all this stuff, the problem was in corporate medicine, as you mentioned, I had 5 minutes with the patient. I didn't have time to go into and talk to him about all this and close follow up and the education and all that. So for you, talk, if you will, about, I mean, was that influential for you at all? Are you planning to incorporate any kind of, wellness type stuff in conjunction to more conventional therapy as it pertains to rheumatologic diseases?
Yeah, great question. I think balancing conventional rheumatology with integrative or lifestyle approaches is key to our practice and what we wish to inculcate in our practice. We would definitely welcome these conversations. And again, that's a strength. That's something that we're able to have with the patients. Like you said, you have more time with the patient, like we guarantee 60-minute, like initial evaluations and then follow-ups like 30 up to like 30 minutes minimum with the patient. So that doesn't really happen in the corporate medicine. So we want to stay grounded in evidence-based medicine, but we also recognize that, like you mentioned, changes in sleep pattern, in diet, like inflammatory provoking foods like high fructose corn syrup, sugar, the amount of movement and physical activity that we do, and then again, stress, trying to find ways to mitigate that. These all do affect autoimmune disease and kind of affect that the experiences that the body has during this pathology. So, without sacrificing our rheumatologic care, we do. Our model gives us the time to talk about these things with our patients.
And I think that's fantastic. And I feel like other specialists would do similar things if they had the time. And, one of the problems is they don't have the time. And some of them, I will say, don't have the education either as far as knowing about some of these lifestyle things and how they can be helpful. But I think one of the main problems is they just don't have the time. So, yeah, I think that's fantastic. So, as it pertains, this is a health and wellness podcast. As it pertains to wellness and specifically, since I'm talking to a rheumatologist, what are some just kind of general, give us some general wellness tips for those that maybe have some type of rheumatologic disease that they can do, that are outside of, kind of some conventional care that
Yeah.
would help specifically with the rheumatologic condition.
Yeah, happy to do that. And I think that's very important. Now, since these are complex long-term conditions, and an important thing to realize is that like a autoimmune disease that is not well controlled is going to have significant systemic effects on your body, not only your body but also your mind in ways that you wouldn't imagine in terms of it can increase risk of lymphomas in the future. It can cause increased cardiovascular disease risk is up to 2 to 3 times more in these patients, like in especially in psoriatic arthritis patients or patients with spondyloarthropathies, and then you see significant cardiac risk with rheumatoid arthritis and lupus. So, given all these risks that these patients have, it is very important to take care of all the other aspects that you would not think of addressing while you have this autoimmune disease. So, success isn't just about the medications or the autoimmune medications that you receive, but it's also very important to make sure you're watching your carb intake, you're watching your complex carbohydrates, saturated fat, your sleep pattern. You are really watching all of those, like high fructose corn syrups, processed and refined foods. They all have an effect on inflammation, in driving inflammation in the body. And the Mediterranean diet does work wonders, actually. If they would like to mitigate these factors, then looking at the Mediterranean diet now, again, everything has to be done in moderation. So, but definitely the Mediterranean diet has the most evidence in literature for supporting these practices. But yeah, so it's not just the disease or the medications, but you do have to be aware of all these other factors. It's also important to make sure you have these kind of conversations with your primary care providers, who can do your lipid panel or check you for your A1C, or just make sure that your health is optimized in every way with a systemic inflammatory disorder.
Yeah, I think, nutrition and diet in these kind of the wellness circles is probably one of the most controversial things, but just to hear a specialist acknowledge, the impact that a diet can make and the inflammation just warms my heart. So thank you for that because I feel like there's just so many specialists that are just, they don't even want to hear it or acknowledge that it's going to do anything. I mean, and so anyways, I think that's fantastic that you acknowledge it and that you're going to be educating your patients about all that. All right, well, yeah, this is great. Anything else that you want to say, just kind of about your practice and and I'll list your website and stuff for people to get a hold of you, but anything else you want to add just about your practice in particular?
Yeah, thank you for giving me the platform. Since we are just starting out and brand new, we are welcoming referrals from primary care providers, other specialists. We have very short wait times, and we are licensed in a few different states. And I could list all of those, but they are on our website, www.remissionroom.com. And yeah, the goal is really to end the suffering that just autoimmune diseases has, the effect that it has on a patient, like their mind, body, and soul, and the fact that they cannot get the access that they need, or they cannot get the care that they need. That is just heartbreaking. And I really
Hmm.
hope I can bridge whatever gap I can. Um, yeah, I would really, we're open to referrals. And yeah, if you can just pass the word and just reach us, we are here to help you.
Yeah, that's fantastic. So, do you only take referrals with being a kind of a direct, care specialist? I mean, can people just call and make an appointment with you, or do you only take referrals?
Yeah, they can actually sign up directly on our website. So we have a inclusive meet and greet session where the patient can decide if this practice and this model works for them. And that is complimentary. And then after that, they can sign up themselves. So patients can directly sign up so that it is as easy as that.
Do you feel like, and again, I know you're just getting started, but as you're talking to patients, because I, deal with this just in the primary care realm, but do you feel like it's sometimes a hard sell because patients just want to use their insurance and they don't really um, understand the benefit of this? Have you felt that to be a big hurdle?
I think, yeah, when I try to explain it to them, I kind of go about it like this is like a gym membership, but it's for your health. So, again, it's kind of the way you explain it to them. But sometimes there is some hesitancy, especially when they are paying those premiums for insurance. Um, so then again, you have to find the right demographics or the right, like again, we do the free consultation just so that patients can know about our model and see if it does work for them. But overall, like the cost of this membership model, if you compare it to your traditional care model, it is like significantly like more than 50% less. And since we are starting out, we have kept our cost very low.
Hmm.
In terms of patient outcomes, like we've had a few, and they have just told me how they're feeling day to day, like they're more engaged. They feel like they are more likely to follow through on treatment plans because they know that we will be there to really ask them, how are you doing all of these things? Let's follow up in a few weeks. Just message me if you have any adverse reaction or if you feel like there's a flare coming up. And then we talk about those lifestyle changes and give them resources for education that does make a big impact. And we have heard that a lot for the kind of patients that we have. So.
That just made me think. I know there's been some studies done with direct primary care specifically and looking at patient outcomes. And there's even one insurance company that pays for a patient's direct primary care membership because they have shown that those patients are less likely to be hospitalized. And, they just feel it benefits them to actually pay for their memberships. Uh, I wonder, and I doubt this has been done, but do you know of any, like studies on patient outcomes with specific conditions as it pertains to specialists, whether it's cardiologist or rheumatology, and patients who are suffering from those things who have a direct care physician, and any kind of longer term outcomes? Anything? Does anything like that exist? Or
Yes, there have been a lot of studies recently. Actually, just 2 weeks ago, there was an article in the Rheumatologist that was looking at telemedicine, direct model, and I think it's more telemedicine based, but it was looking at outcomes for patients compared to the traditional model. It found actually enhanced. These patients had better outcomes. There has been another study that is in Oxford Rheumatology. This looked at like a DPC care model done in Japan. And it actually found that patients had similar outcomes. They had reduced healthcare utilization, so lower healthcare spending. So the literature is definitely there. And then for the DPs, like the direct primary care model, definitely there's a lot of literature out there that does support this model, which is why this is so beneficial. Like it's a huge relief. Like when we explain this to patients, there's a huge relief that they can have this sort of care without long waits and without short visits.
yeah, very nice. Well, I love what you're doing, and that's really why I wanted to get you on the show. Is I haven't had a specialist who has done this, and when I kind of came across you, I thought, gosh, I really want to visit with her and just get you on the show. So appreciate you coming on. Like I said, I love what you're doing. I'm sure you'll be very successful, and I hope that more specialists will catch on and do similar type things. So as we kind of wrap up here, my guests know I always, or my listeners know that I always ask my guest if they could give us one health tip that would make us healthier today. What would you say to that?
Mhm. And firstly, thank you so much your interest and for the appreciation, and then also for looking into our practice and having us talk about like what we do and why we do that. In terms of the healthcare tip, I think it's important to really know like what are we ingesting, or what are we really like doing in terms of our daily intake, like our meal intake. We should really look at the labels. I think now we really have to do that. Look at like the sugars, added sugars. Look at like color dyes, food coloring. We really have, and there's a really nice app that I sometimes use. It's called Yuka, I believe. And that has some great tips in terms of giving you information, yeah, Yuka, about like what's, you can really scan just a QR code and it pulls up all the health risks associated with it. But if we're like really being more aware of what we're putting into our body, I think that's very important, because there are things that you would be surprised are in, like, for example, there's high fructose corn syrup in ketchup, and a lot of people don't know that. So it's important just to like really read the labels and see what's in there. Especially patients with autoimmune disease, like with the risk of cardiovascular disease, they really want to keep their saturated fat content low. And these are all changes that they can make just by taking these small steps.
Mm-hmm. Yep, that's fantastic advice. So we'll appreciate that. And so Remission Rheumatology, Dr. Serene Mumtaz, check out her website, remissionroom.com, and see what she's all about. And as always, I appreciate everyone listening, and we will talk to you next time.
Thank you so much. It was a pleasure to talk to you.
Thank you. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like to contact me, you can visit our website at fitrxwellnessok.com, or you can email me at drgreg@fitrxwellnessok.com.